Dr. Cora Constantinescu is a pediatric infectious disease specialist in Calgary. She joins me now. Doctor, thanks so much for your time today. Appreciate you speaking with me.
Nice to be here.
Let's start with the one-year anniversary today of the declaration of this pandemic. Let's start there. What's top of mind for you today?
Well, it's an emotional day. You think of what all this has meant for us, for me personally, my family, our country, the entire world. So many people have died. There's so much loss. But there's also, I think, a palpable sense of hope. Now, with over 2.5 million doses of this vaccine administered to Canadians, and I know some of my family members have had the vaccine, and soon I hope to send out my parents for it. So for sure, there is hope. We're seeing this specter of death and hospitalization start to lift from our society.
It gives us a chance to reflect as well on where we've come from. What do you think our political and health leaders have done well over the past year in responding to the pandemic? Let's start there.
Yeah. Before the political leaders, I'll just say how well Canadians overall have done, because I think our society has been so good and kind, and people have really listened the answer to, the call to inaction, to stay at home, wear masks. And they've given up a lot of personal freedoms. And because of that, we've had so many fewer deaths than we would have had. I think overall, though, our political leaders and our health agencies have done a lot of things well. Our vaccine choices were very well made. So now we have 4, soon most likely 5 of the 7 vaccines that they chose. So even in those early stages, they chose really well. And I can't speak nationally, but for sure in Alberta, our testing and public health measures have worked really well. We have fast turnaround time on tests, broadly implemented, very adaptable. So for example, now we test for variants, which is why the testing in combination with all the health measures is why we have not been overwhelmed by these variants. And I think our contact tracing was good too in the beginning.
Let's talk about preparation. There's lots of evidence that Canada wasn't prepared for this, with no early warning system in place anymore, no domestic vaccine manufacturing capability, no well-rehearsed pandemic plan, even though we developed one after the SARS outbreak. As an infectious disease specialist, what do you want to see moving forward? Because it's a pretty safe bet we'll have another pandemic and more waves of COVID-19 as well.
Yeah, I think you're right on. So, this isn't over yet. And I agree there are a few things, long-term and short-term. So long-term, for sure, emergency preparedness. We struggled in the beginning, issues with supply of PPE, just local and national production, definitely an issue. And then the protection of our vulnerable people in long-term care was not fast enough. So this is something for sure that we need to improve on, identify who the vulnerable people are, and very quickly, so high speed of initial response needs to be there to protect them. I also think that, especially because this isn't over yet, there's also been a lot of communication hurdles that we've had, which at the end of the day changes behavior and affects how people comply. So, for example, everybody's been making such an effort to adhere to public policy, and we see change frequently, and that can be disheartening. We can definitely do better at communication, and we have to, because this isn't over yet. So with our previous communication, when there were wild swings in recommendations, and then the response was often defensive, focused on correcting misinformation, to the point where I think people fell victims of public policy instead of seeing it there to protect them. And we now, and we're seeing more of this, that frustration comes out of fear and comes out of a sense of unsafety. So we need to arm our local leaders within people's communities to get out and address this inconsistent messaging by building common ground and trust. So this is really important. We almost need a public relations network of local champions to connect with people and validate their emotions and struggles.
There is a sense, you touched on it, there's a sense that perhaps a corner will soon be turned with the increased vaccinations, but look, here we are into year 1, but now pushing into year 2 now. There are still variants of the virus circulating and building, and I'm wondering what you think lies ahead for us now and how quickly we might be back to something, I'm not going to say normal, but something closer to normal.
Yeah, so we cannot get ahead of ourselves because it's not over yet, but we're definitely on our way, and and we're very close. And what's really important is the speed of the vaccine rollout and people's readiness to take this vaccine. So we've heard a lot of concerns from people about what vaccine to take and when to take it. Take it as soon as it's available to you and take the first one that's available, because that makes a huge difference. In time, the lifting of restrictions will come as we vaccinate more people, as we drive the numbers down, and as we remove this burden of hospitalization and death from our health system and our society. And we will be able to go back and, no longer physically distance and no longer mask. Even though I have to tell you that as a mother of 3 kids in school, I have enjoyed our relatively virus-free lives in the last year. But this all will come when our vaccine numbers and our coverage will go up.
Okay, I should point out, you talked about taking whatever vaccines available to you. You should point out you're with the Vaccine Hesitancy Clinic as well, so you've got lots of
That's
experience on that front. Look, we've seen a lot of let's finish on this, some major changes in behavior around personal hygiene and masking and so on because of the pandemic. What behaviors do you think we should be prepared to carry forward?
That's a really interesting question. I sure hope that people carry forward the hand hygiene. We know, I mean, look at the fact that we don't see any influenza. So there are very powerful ways to protect infection, especially again from people who are vulnerable. So I hope the hand hygiene moves forward. And to some extent, the idea of presenteeism, so people being at work when they're sick, would be great to not continue moving forward even once this pandemic is over. So this idea that when you're sick, maybe there are ways you can work from home so that you're not exposing other people, especially patients in hospitals and in other clinical settings, is really powerful. So for me, those two for sure should move forward.
All right, Dr. Cora Constantinescu, thank you so much for your time this evening. Appreciate it.
Thank you for having me.